Hello, everyone. I hope you can hear me. Um, we're just setting up as we have more people kind of joining us, both for our Zoom session and our for our YouTube live session. Um, this is our second time doing this. We will be having it's a little bit more clear in terms of the system as well, in terms of what we're looking for. The first time that we did it was last week. I just wanted to kind of really confirm that during Ramzans, particularly, we will be having this at 2 p.m. to 4 p.m. It will still be a 2 hour session. And I'm really hoping that we will be able to kind of cover a lot more ground today in terms of boundaries in therapy, particularly. I hope last week's session was a little bit more helpful as well in terms of burnout. I didn't have much of the notes prepared for last week. It was just pretty much from what I had learned and what I've experienced. My intention is in this particular session to be a little bit more structured in terms of what we might be covering. And what I'm realizing is that as we are moving forward, there will be certain days in which I would be doing demonstrations in particular, like, for example, grief and even with boundary work, in Gestalt work, humanistic work, there's a lot of value in having a lot of demonstrations done, particularly. So I'm just still trying to figure out what would be more beneficial. Would it be more beneficial for it to be done? Like, for example, if I was to do it on myself and see it, in terms of being able to show you guys that as a practitioner, अगर आप अपने skills को proficient करना चाहते हो तो आप उसको कैसे कर सकते हो by first taking a tool and doing it on yourself, or we can even invite someone from the outside, or even if there's anyone from the Zoom participants who would like to kind of volunteer, we can come in and kind of have that experience as well. So there are many different kind of things that could be coming up. Yeah, absolutely. It would be nice to have a combination of sorts. Some days having someone from the Zoom session come in, like Gestalt is a really good day to have that, or Humanistic is a really good day to have that. Or, for example, when you're doing grief work, you can kind of do it on an individual, and then obviously kind of it really shows you how you can do it on clients also. One of the things that was really beneficial from me from the last session in particular was the chat box. So specifically on YouTube, there was a really good chat conversation happening, and it was really good to understand or get feedback, particularly on some of the thought processes that were kind of taking place. And one of the main ones was regarding westernization, right? Like, is this westernized in terms of um, is this westernized in terms of what we've been taught? So, so I can just kind of a little bit add a little bit of a brief background about myself. So the reason why I talk in English or have had is because um, I had a lot of difficulty growing up in terms of the languaging, particularly Urdu. I was dyslexic. तो क्या होता है कि इंग्लिश में डिसलेक्सिया की रिमीडियल ट्रेनिंग्स होती हैं, लेकिन उर्दू में इतनी रिमीडियल ट्रेनिंग नहीं होती। तो जिसके वजह से जब मैं उर्दू में बात करता हूँ तो इट वाज मुझे बहुत ज़्यादा मुश्किल होता था, खासतौर उर्दू के लिखने में और बोलने में और पढ़ने में। इंग्लिश में आई गॉट इम्प्रूव बिकॉज उसकी वो मुझे उन्होंने एक्स्ट्रा रिमीडियल ट्रेनिंग्स दी थी, जिसकी वजह से ओ लेवल्स ए लेवल्स में मुझे एक्स्ट्रा हेल्प मिला था। तो माई माइंड बचपन से बिकेम मच मोर safer in kind of talking in English, thinking in English. So I wanted to kind of share that कि my intention is कि ये content जितना भी हमारे पास आया है उसको मैं उर्दू में, English में, like for me it's about being able to deliver the content, and I'm really hoping that अगर आप लोगों को I'm really hoping that the niyat translates more than anything, right? I'm really hoping that the intention behind what I'm saying and the intention is a little bit more translatable. And if there is any challenges that you guys are understanding in terms of concepts, you guys can reach out to the center. I'm more than more than willing and wanting to kind of really help in developing therapists, particularly, right? And my intention from these for these 11 days is that as now it's going to start compounding, is so that we can actually kind of create a culture where all of this knowledge is pre requisites, right? आपको ये सब चीज़ों के बारे में actually में therapy में होता क्या है सब पहले से पता है, right? Those are all some of the things. So for the last 4 years at Trauma Release and Wellness Center, we have been intending to culturize a lot of the content that we have been given from a lot of the international trainings that we have done. हम लोगों ने EMDR करवाया. EMDR का यहाँ पे already एक existing trainer हैं और हम लोगों ने उनके साथ थोड़ा सा ऐसा काम किया. उसके बाद we went to Arizona as well. And we got trauma informed training. अब वहाँ पे वो westernized culture पूरा था, लेकिन Arizona particularly अपने affiliate program के साथ काम कर रहा था. तो इट वाज रियली नाइस कि उन्होंने हमें बहुत ज़्यादा हेल्प किया यहाँ पे और इंडिपेंडेंस दी यहाँ पे अपने इस उनके प्रोग्राम को कल्चरली इंटीग्रेट करने की. And I did want to share that one of the main differences that we found was that यहाँ पे particularly family therapy was a lot more important as compared to individual therapy particularly and collectivistic cultures के अंदर. Another thing that we found which was so interesting was that यहाँ पे the dorsal response यानी कि freeze response जो होता है वो बहुत ज़्यादा proficient होता है as compared to fight or flight. Fight or flight भी होता है लेकिन freeze is also very prevalent. So as therapists particularly इन चीज़ों के साथ काम करना आपको मतलब आना है, proficient होना है, right? You want to become really skilled in that. इंटरनेशनली लोग बोल देंगे चीज़ों को, लेकिन यहाँ पे लोग अपनी बेबसी को बहुत ज़्यादा अपना लेते हैं. मैं कुछ नहीं कर सकता, घर से भाग नहीं सकता, मेरे घर मैं रिश्तों में फंसा हुआ हूँ. There's a lot of freeze response that is very culturally available. And I just wanted to kind of give these kind of contexts particularly prior. So I'm really hoping कि अगर आप लोगों के पास कोई सवालात हैं, questions हैं, तो I want you guys to be able to drop it in the chat box, you know, ताकि in the future, in the next training that will happen next Friday, I will kind of just answer some of the questions from those trainings in the start, ताकि the engagement kind of increases, your questions can increase. It can be at least like a once a week kind of two-way conversation that we're kind of having about these things. So that's the first aspect of it. Okay. So let's come into what we're going to be discussing particularly today. So today is about boundaries and in therapy, and this is something that I've been really kind of I've had a personal journey with this. I probably that's something that you will see me say in most of the trainings because that's how I learn things. I learn things through kind of having experienced it myself. So and that's something I prefer as well because I think there's a certain level of honesty or congruence and the challenges and the hurts become a little bit more recognized. So that's pretty much what we're going to be working on. So हमारे boundaries in therapy में तीन topics हैं जो हम आज cover करने वाले हैं. Primarily one is going to be about handling emotions in therapy because that's something that I've heard or seen as well कि usually therapist के और client के sometimes खुद boundaries जो हैं वो compromise हो जाते हैं when it's an emotional situation that takes place. You know, whenever there's something like an emotional intensity, especially if it's at the end of the session, there is a little bit of dysregulation भी बोल सकते हैं or there is a confusion between empathy and enmeshment, right? And that's the kind of challenge that we want to work on, be able to describe, catch what is that difference? How do we kind of cover those things up? So emotional handling in therapy, that's the first thing that we're going to be covering. Second thing that we're going to be covering is primarily about boundaries to support clients. And this is something that I had a really kind of transitional moment with, particularly for myself also. I really realized कि किस तरह boundaries इस्तेमाल कर सकते हैं client से client की history से safety create करना, right? And उसको हम किस तरह देखते हैं particularly when it comes to creating boundaries. So that's number two. And number three is going to be a lot more about practical boundaries. किस तरह रख सकते हैं हम लोग की exactly, you know, like boundaries के बारे में क्या information होती है particularly, right? And so how do you kind of see boundaries? And the way I have developed or the way I have seen boundaries and the model that I particularly like is Pia Mellody's model, right? So Pia Mellody was one of the people who wrote the book Facing Codependency. I have a background in addiction work. So before I got related to trauma work, what happened was that I used to work in rehabs. And rehabs में आपके पास addicts होते हैं और codependents होते हैं, right? और addicts का technically लोग addicts के लिए आते हैं, addicts का एक काम होता है, लेकिन हकीकत में a lot of the work of recovery has to happen with the codependent, rescuer, enabler, different names, right? And उनके actually में होते हैं boundary issues. They have a lot of trouble keeping boundaries. So Pia Mellody did a lot of good work with that, and she wrote a book called Facing Codependency. And in that book, there's a really good system of boundary evaluation that's done. And my intention, hopefully, today is to share that with you guys, ताकि आप लोग उसको अपने जिंदगी में खुद पहले और फिर दूसरों को हेल्प करने में इस्तेमाल कर सकते हैं. So that's hopefully what we're going to be covering up at the end of the topic, right? So again, as we're having these conversations, specifically for people at Zoom, if you have any particular questions, start sharing them as they come along. Specifically, अगर आपने अपने skills practice के अंदर कोई questions देखा है, आपने अपने therapeutic work के अंदर कोई questions हैं इन चीज़ों के हवाले से, boundaries के हवाले से. So hopefully through the course of this training, we're going to be able to kind of answer some of those questions and really add value to you guys as well. All right, so first of all, right, emotions, right? Emotions have always been such a how do I say this? Like, can you imagine? Emotions are the reasons why people sometimes use addictive substances to what people use addictive substances to escape, right? We're always in some kind of feeling, right? I could be I am feeling scared right now. I'm noticing butterflies in my stomach right now. I'm noticing that when I notice sometimes myself getting a little upset or angry, or a little bit more intense when it comes to the type of ethical practice or the work that needs to kind of happen, or sometimes my own expectations from the the quality of service that can be provided. I'm quite passionate about those things, and thus I want to be able to support or deliver people or help in terms of that kind of development. That's one. Or what I can do is what can happen is that I go into a sense of sadness or grief whenever there's a certain level of change that takes place. And human beings are always in a certain sense of emotions, right? When we're growing up, we're never really taught about these feelings. We're never really taught, and there is a genuine sometimes lack of vocabulary that we have about whether we can describe what we're feeling. Sometimes our feelings are just generically kind of modified to anger, fear, sadness, and there are certain nuances. Anger may be kya, right? Frustration, irritation, right? Criticism, all of those things, resentment, all shades of anger. Fear may be kya? Fear may be sort of like abandoned, scared. There's all of those elements, sadness, grief. And ideally, what I would suggest invite people to have is like have a feelings chart for yourself, right? That really helps you describe the nuances of the languaging and nuances of these kind of things. Okay, so we all have feelings and we all kind of work with it. So what happens is that clients come in, and sometimes what happens is that they come in with this sense of emotional dysregulation, right? They don't know how to how to feel their feelings, because sometimes what they have gone through is a lot, right? And thus the emotions of that experience, that could be either from the past or from the present, is very actively present, right? Feelings के बारे में एक particular चीज और भी ये होती है कि जब तक आप उसको feel महसूस नहीं करते तब तक वो present रहता है. There is this book called Emotional Intelligence, and I recommend everyone should read this book, right? In that book particularly, there is this thought process that your emotions are there to tell you something about yourself. Okay, what that means is that if I am noticing anger in my body, okay, that means that if I know, or if I have that kind of introspective awareness that I'm noticing anger happening in my body, that means कि मेरा anger मुझे कोई चीज मेरे बारे में बता रहा है. That, for example, if I'm facing anger, that means that sometimes my boundaries are being broken. So the books, so Emotional Intelligence is the name of the book. I don't really remember the author's name. Emotional Intelligence 2.0, you guys can kind of Google it. My emotions are telling me something about myself, right? So particularly if I am feeling sad, what that means is that there is a change or a loss that I have gone through. If I'm feeling afraid, what that means is that that whatever I'm afraid of either losing it or it happening again. And so that means that there's a desire for me to protect myself, right? So all of my emotions are there to tell me something about myself. The reason why it's important to really understand emotions and the value that they bring to any experience is because it's not like our job is not to stop feelings, right? So for example, as a therapist, agar koi banda grief ke saath aata hai, so you, the intention isn't to help them move away from their stop feeling grief. That languaging sees grief as a problem, and technically, grief itself is not the problem, right? We have to be able to hold space for their grief so that their body can grieve appropriately. We can't rush them. We can't tell them it can't happen. We can't stop them from happening. Like, we have to really allow space for their body to experience those feelings. And as long as they're sometimes in that situation, their body will consistently need to sometimes feel those feelings as well. So what happens is that when we have this kind of understanding that emotions are not bad, so yeah, and are information about the client. So if the client is getting angry at someone, that means that the client feels or notices that their boundaries are being broken by that person. Okay, because whatever they want, they are not being able to get that, and thus their boundaries are being broken, right? And so emotions really help us understand a person. Okay, so what happens is that when we're talking about holding space or setting boundaries with emotions, because it is such a common thing that I've heard many therapists kind of say that end mein jaake, right, at the end of the session, there's an emotional release that takes place, right? And when that emotional release happens, what happens is that it doesn't feel empathetic, right? That's sometimes the word they use. It doesn't feel empathetic enough for us to end the session there, right? And yes, that might be true once, right? Sure, you can. I'm a really firm believer in having functional boundaries and not walls. And as we go to the end, you guys will really have an understanding of what these kind of definitions are. But I really do believe that agar aap, for example, once it happens, it's great, no problem, right? You can absolutely go for it. It happened once. But if it's a recurring thing, right? And as a therapist, if it's happening with most of your clients, or if it's happening with one particular client consistently, then it's a boundary issue. That means that then it's a relationship with the emotions that they're experiencing. And my intention is to really share कि उस emotions के हवाले से ऐसी क्या क्या चीज़ें होती हैं जो आपको आपके boundaries को तोड़ने पे मजबूर तो नहीं करती, but in the sense कि आप उनको तोड़ देते हो for some reason, right? And that's sort of like what I'm really wanting to kind of trying to explain here through this process. Okay, so emotions hote hain. Emotions are there for us to find information about the client in terms of what their internal experiences are, how are they really kind of perceiving things regardless of what they might be saying, right? So for example, if someone is really visibly sad, right, and they're saying that mujhe isse koi farak nahi padta, hakikat mein their body is saying that there is a loss or a change that has happened in their life, and there is the grief ka step hota hai na, denial. There's a denial that kind of takes place, and I want to really kind of change that aspect of it. So that's number one. Okay. So when you see emotions as information, right, then there is a difference between holding space for that information and being absorbed by that information, right? And that's a distinction that you want to be able to make very effectively, right? Like for example, at the end of the session, the client is starting to emote very actively, right? It is, and if your nazariya is that ये emotion जो है मुझे client के बारे में कोई चीज़ बता रहा है और उस चीज़ को मुझे सुनने के लिए actually present होना पड़ेगा ताकि मैं client से वो चीज़ सुन सकूं, तो what will happen is that I will very empathetically, kindly, and for the purpose of benefiting the client, tell the client that देखिए, I want to be present for what you're really saying right now. I think what you're saying right now is very important. I do think that with the time that we have available, we will not be able to really hear what this emotion really wants to tell us. Is it okay that in the next session, if I can bring this up? Okay. And even when you say that, you don't kind of say, okay, jump and go. You kind of take a minute to breathe. Is it all right that before we actually leave, can we do can we do a little bit of a breath work here? Can we do a little bit of a grounding exercise? Just to kind of really center or hold space for how important this emotion is wanting to say what it needs to say, right? And how it's important for us to really give it space and hear it. And so you really help the client feel acknowledged, right, for the space that they have with you, right? And you're really seeing the emotion, right? Because it's the emotion that is of value, and it's the emotion that really wants to say something. And you want to be able to hear it because that is what will give you information about what the client is really trying to tell you. Okay. However, right, if you get absorbed by the story, right? Yani ke, for example, because traditionally or generally what happens is that where our memory lives is where our emotional centers are also close to. So anytime when I am recalling an emotion, if it is an intense emotion, what happens is the emotion, the if I'm recalling a memory, then the emotions that are associated with that memory also come up. That means that in order for me to express my emotions, I will tell you what happened because that's the way the mind is connected as well. Okay. यानी कि अगर मैं कोई सैड वाकया याद करूंगा तो मुझे जो है वो इमोशंस भी उसके साथ महसूस होंगे अगर मैं उसकी इजाज़त देता हूँ. There is a अगर आप बोलो कि आपके दिमाग में मेमोरी जो है या इवेंट्स हैं वो कैसे फॉर एग्जांपल उनके क्या फोल्डर्स होते हैं वो किस तरह डिवाइडेड होते हैं emotions are or memories are like clouds or clusters, right? So what that means is that if you have a particular cabinet of sad, right, and you notice one sad emotion take place, what will happen is that it will evoke a particular memory, and all the other memories that are associated with sadness, they will also start coming up as well, right? And so that's how the brain is kind of designed because it clusters memories together, right? If you notice any time that you're feeling alone and you're recalling an event, if you can really think, you will be able to recall all the other events you were feeling alone also. The reason why we recall intense emotions particularly more than positive emotions is because they are more valuable when it comes to survival also, right? Because जब मैं इन इस intense emotions को याद रखूंगा और अपने आंखों के सामने रखूंगा तो ही जाके मैं मेक श्योर कर सकता हूँ कि यार ये कहीं दोबारा ना हो जाए मेरे साथ. आई वांट टू कीप श्योर दैट आई एम मेकिंग श्योर दैट आई एम अलर्ट or I haven't really resolved this, and this is the main thing that I want to resolve. So that's why we are so connected to expressing our emotions through our narration, because we want to really make sure that those experiences don't happen again, and that's the way the mind gets structured. Okay, so now imagine there's a therapist sitting and they don't know this information, right? What they see is that if a client is saying their story, for me to acknowledge their emotions, I have to acknowledge the story, right? And what happens sometimes with the story is that the story can be relatable as well, right? The story can be absolutely relatable for the therapist, right? And sometimes what happens is that because we are sometimes trained to listen, right? and and when I say listen, and I don't mean like purely active listening, I'm talking about like just verbatim, right? Kahani kya hai, chai kya hai, client bol kya raha hai, right? So when the client is purely kind of expressing the emotions particularly, right? So when the client is purely kind of expressing um, what they are going through in the form of their narration, the therapist can sometimes get stuck on the story. And what happens is that because they're trained to empathize for what has happened to them, they've really lost this piece of information that your narration and your emotions can be acknowledged separately, right? That I can actually hold space for your emotions, right? And without having to really kind of go into details about what was the experience, what was the depth, which can cause a sense of re-traumatization to take place as well. Okay. So that's something that is very important for therapists to have. कि आपका एक holding space होता है, right? In which you're really acknowledging the emotions that are taking place, versus getting absorbed into the situation कि आपने अपनी कहानी से client को relate करना शुरू कर दिया क्योंकि वो एक relatable है. And what happens is that when you start getting absorbed into the uh, when you get absorbed into the situation, what happens is you start getting you start losing your boundaries also, right? You start saying, okay, I'll give you 5 more minutes because technically you wished someone gave you 5 more minutes for those feelings as well. Okay, and that's sort of like the difference that kind of takes place. Okay, what starts to happen is that on some level, and especially when it comes to emotional boundaries which are associated with the narration, what happens is that on some level, therapists also have unresolved emotions and unresolved experiences, and that clicks or transferences hote hain, that clicks with sometimes the clients as well. And so what happens is that when that clicks with the client or when that gets hooked with the client, there is a reliving that's happening for the therapist also. There's a like the therapist is sometimes trying to resolve, give space to their own emotions through the client, right? And that itself breaks their professional boundaries of the work that is taking place. And it's very important that we do our own personal work. And we talked about this for burnout management and all of those things first. Or at least if we become aware of it in the session, we take it to supervision, right? It's important that we take it to supervision or we take it to our own therapy so that it doesn't contaminate the way we can hold space and the benefits that we get from the boundaries that's it's important. Okay. So it's also important to understand that when we are in that space of emotional holding, there is a sense of tolerance that our own personal bodies have with certain emotions. For example, for me personally, it was very easy for me to hold space for grief and to hold space for shame because I had done that work for myself and I had a lot of it on my own also. So, matlab, I was like, let that go, have that space. It was really difficult for me to hold space for anger, right? So when it comes to shame, when it comes to what do you call it, fear and some of those feelings, or grief particularly, I would be like, I would have much more healthier boundaries. I didn't have a certain kind of difficulty with it, right? Because I had kind of been able to resolve some of the feelings that I had associated with it. I'd kind of come to a place where I can kind of see my shame without jumping into it, right? That anytime I would feel ashamed or I would kind of feel that sense of overwhelm, I could be able to regulate and I won't need to kind of drown into those feelings. But when it came to anger, right, or when it came to fear about other people's anger, that was something that I still hadn't resolved for myself. So anytime I would see people going into that in particular, or having other people go into a lot of anger, I would come into walls, right? So I would, because I would feel afraid, I would go into walls. So I would be like, nahi, 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 band karne isko. Like, hum isko abhi deal nahi kar sakte. Hum isko rokna hoga. We have to stop this right now, right? I don't think we'll be able to work on anger right now. We'll work on anger today, but tomorrow, right? So you can see that there was a certain rush in which I would be cutting the client, right? I would be kind of holding space because I hadn't resolved all of that work. And this is what counter transference is all about, right? Counter transference is all about what has come from your own personal experiences that comes into the work. Next week, I'll be very honest, we're going to cover Carl Rogers' work, humanistic stuff, right? Person centered therapy. And in person centered therapy, Carl Rogers himself said that transference and counter transference is the work, right? So the more we are aware of what is transferred onto us and how we are responding it to it, that's something that's important because that is how we are able to stay. अगर मुझे पता होगा कि मेरा anger के साथ relationship is not good, right? If I know that my relationship with anger is yet to be worked on, and I am having active difficulty actually creating that space, then what will happen is that I will actually be able to find resources, work on some of these things for myself to be able to hold space for that. So that's the counter transference element for it. There's a lot of importance when it comes to learning these things beforehand, right? Because when it comes to emotions, if my emotions are regulated, then I can set my boundaries with the right intention, right? If my emotions are not regulated, for example, I saw a client at the end of the session going into anger about something, and what that did for me, because of my relationship with anger, countertransferentially, what happened for me was that I started to get afraid. And because I wanted to avoid the situation, I had to like end the session in like a space of like, देखिए हमारा session जो है वो खत्म होने को आ गया है. This is us coming to an end. We need to pause right now. Pause. Okay, so and that's the unsafe way of creating an ending, because what that does is it interrupts the attunement that the client is developing with you. Okay. Technically, that's if you're in a private practice, right? More practically, if you are renting room at a place and you have someone else's session happening after your session, panic sets in, right? If you have back-to-back sessions, panic sets in. If you have a client that you know you're always having difficulty setting time with, and panic will set in, right? And anytime you will be setting a boundary with anger or panic, you're setting a wall. You're technically you're bringing up a wall rather than having a boundary. And again, at the end, we will go into much more details about walls कौन से होते हैं, no boundaries क्या होता है, functional boundaries क्या होता है. Pia Mellody ने particularly क्या बोला इन चीज़ों के बारे में, right? And so emotional regulation, without going into your own narration, is very important as one of the first tools that you need in order to create safe emotional boundaries. Okay. Because if you're able to emotionally regulate, then you can hold space for their anger also. For example, client is not responsible for watching out for the time. It's the therapist's responsibility to watch out for the time. It's the therapist's responsibility also to be able to uphold the session ka time frame, right? So agar, for example, client ke no boundaries hote hai, that means that generally from their experiences they've had trouble containment ke liye, right? Being able to contain their experience. So what happens is that the therapist can sometimes, because of their own relationship with lack of containment, they can get irritated, they can get angry, right? And so what happens is that they could go into pause, right? So you can even start dysregulating yourself, and thus the boundary that you set is incomplete or is not actually efficient or effective. The reason why I'm really taking this time to actually really reiterate this particular concept, or really reiterate, is because there sometimes becomes this expectation or this assumption that boundaries is a technique that you have to do, right? That if you know a certain language, or if you are able to set a particular word, right, then what happens is that you are able to kind of set those boundaries. However, the step before setting a boundary is all about emotional regulation, because there are certain things that in your own personal life you will have no boundaries for. For example, I was a people pleaser, right? And that means that when it comes to, and I told this in the first session particularly, that I was all about help the people, right? Help the people, and at the cost of my own sense of self. And so when there would be a client, and the reason why we're just focusing on at the end of the session is because that's a really common way of visualizing it. So at the end of the session, if the client wants more time, I'm just really waiting for them to finish what they're saying so that I can nicely say what they need to say. The reason why it was important for me to be able to quote it nicely, because there is an unmet need to be liked, right? And because there was this unmet need to be liked, I had to say it in a manner which was ताकि उनको बुरा ना लगे, so that they don't feel upset about it, right? And that comes from my own internal wounding. That is not the client's responsibility, right? It's very important for me to make sure that if I am having trouble setting boundaries because I don't want to be disliked, I have to make sure that I am aware, okay, what happens to the client if I don't set boundaries or model boundaries for them. What am I really doing, right? Because it's only when I really understood कि इसका नुकसान क्या है, right? Like what are the damages that happens when a therapist does not model healthy boundaries or safe boundary conversations for a client, right? And what happens then, right? What happens to the work? And only when I was able to understand that was I able to find the value in overcoming my own sense of shame and insecurity कि client को बुरा न लग जाए, because my main motivation was to help the client. And I was like, okay, let me get over myself and actually help them by setting a boundary, right? And it was one of my supervisors actually that really helped me understand that process in a much more effective manner, right? Because what happened was that when I was learning how to develop myself as a therapist, right, and I was early, and I was like, I'm talking about 8 years ago now, right, and I was in supervision with one of the supervisors, right, and in the supervisors, what would happen was that I was always ending the sessions late, always, like always 10 to 15 minutes late, and my other therapist would be kind of waiting sometimes for my other clients would be waiting, and what will happen, it would be like a trickle down effect. So first client would be 10 minutes late, second client would be 10 minutes late, third client, so there would be like a whole thing. And I would be like, yeah, because I was giving them full time, it shouldn't be an issue, right? I was like, okay, they waited for 5-10 minutes, that's fine, let me create. And I always had this kind of main issue with boundaries, and sometimes it still comes up, right? So my supervisor, and what happened was that this boundary issue denounced to myself that I did not know it. But what happened was that these boundary issues also showed in other spaces of my life as well, where I would be having trouble saying no or setting my boundaries with other aspects of my life also. So, for example, because I would not be able to say no, I would not be able to say what I needed. I would always be coming late to the supervision, right? Because I would always have an excuse, my session ended late, or I was running late, and there would always be this rationalization that would be kind of running in my head. So my supervisor, and this was like early kind of days that kind of happened. My supervisor was like, she told me, right, if you come in late, I'll make you pay for a session. Okay, sure. Archaic, right? That's not exactly how I would have still done it, right? I would have still done it more effectively. But she was like, from her experience, she was like, I'll make you pay for a session, because she was trying to teach me something, and I was like, later I figured it out, okay. And I was like, sure, sure, I won't come in late, that was not my intention, I'll kind of, I won't come in late, that was not my intention, and all of those things, right? And then what happened was that I came in late because muscle memory, right? So habits don't break that easy. So any of you guys, if you guys think that, oh my god, after this it's going to be super easy for me to set boundaries, if you're having trouble setting boundaries right now, you're going to have trouble setting boundaries after this training also, right? It takes a lot of effort to intentionally set the boundaries particularly. So she was like, I'm going to make you pay for the session. And beknownst, the next two sessions I was late again, and I was like, she made me pay for it, and I was super angry, I was super upset, I was like, you can't do this to me, this is not fair, supervision isn't cheap, right? Like, you're making me pay for all of these things already, and then on top of that you're making me pay for this again. I was super upset, like almost as if like my relationship with her was actually going to come to an end, and I was like, this is the worst thing. And I was holding on to sometimes resentment towards her also, like fully blown anger, right? Because she set a boundary with me. She was like maintaining value for her time and all of those things from the way she kind of was doing it. Okay. And I asked her, right, like, what is this, right? Like, why are you making me pay for something, right? How is this fair on me that because I'm coming 10 minutes late, that I have to pay for a whole session? And then she was like, you've got to make sure that by modeling boundaries, you're really helping the client understand that it is safe for them to end the past and that they can start again when they come back, right? Because when they are in that narration, sometimes, because they're not just connecting to the emotions, they're connecting to the narration. Because they're sometimes connecting to the narration, what happens is that they're sometimes reliving the experience. And by setting a boundary and by pausing, you're really telling them that it is safe for them to pause, they will take care of the emotions because they're still living with it even before they started therapy, and that they can come back, and that it's okay for you as a therapist sometimes to model that, even if you're seen as a bad object, psychodynamic bad object, right? And as long as you're doing it with emotional regulation, attunement, not coming from a dissociated place, not coming from a place of wall or anger, or coming from a place of emotional regulation, what you will be able to maintain while you're being the bad object is attunement with the client. Okay. And that's something that I was able to understand, that okay, when it comes to these things, it's important for me to understand that in order for me to tell the client that okay, it is safe, your emotions are not a bad thing, our purpose of therapy is actually not to stop your emotions from happening, right? So it's not like if you were to release these emotions now, they are going to go away, right? They're still going to be there. We have to create a relationship that is different with these emotions than what it was, right? Rather than them being a reason for remembering the past, it's actually a reason for really understanding a sense of emotional intelligence, right? And this is something that we can kind of work with. We have a web person experience sharing the experience that the teenager during a session is interrupted by visits from any family member randomly for chores or stuff. I asked her to lock the room during sessions, but either forgets or she doesn't like it for her to interrupt for her interruptions are okay at times, right? So I will go into exactly what's really happening with her particularly, and I'm really glad you brought a client in, because so that we can really kind of make this a little bit more relevant, particularly as well for people, right? So, and I'll just use some words, and I'll go into the explanation of it later. Is because for her to have no boundaries with families is a lot more safer to have boundaries with uh, you, right? Because she's having no boundaries with the family, it's much more safer, right? Because until and unless she has the resources to say no to the family, she is never going to be really able to set for the family. So what happens is that, and we'll go into this in retail, the therapist can model smaller boundaries first, right? Because setting a boundary with the family at this stage wasn't practical, right? Wasn't possible, even able to maintain. In the end, that's the work, that's the direction of the work. So what happens is you kind of break it down to something even smaller. Have you ever said no to a family member, right? So it's not even कि आपने कभी अपना कमरा खुद से लॉक किया है, right? Have you ever locked the door, right? So really using sometimes the past experiences to really recognize the client's capacity to be able to do it in the present, right? And you really can use boundaries, particularly, or like this level of boundaries कि कहाँ है कहाँ नहीं है, right, as information for the work, right? And that can really help making the work even more effective and meeting the client sort of where they're at, and then kind of empowering them and building them through, because they want to get better and you want to help them get better, right? And that's the whole benefit of this whole process, is to really help recognize कि, "अच्छा यार, हम इसको, how can we really hit home with these kind of spaces and with these kind of works," right? So emotional regulation really helps in creating awareness about transference, counter transference. It really helps in us setting the right words and the right language when we are able to set the boundaries, so it does not break our attunement with the clients, right? So that's the pre-setup work before actually the boundaries took place, and so we're really kind of in that kind of space. All right. So now let's go into the point number two, right? Which is how do you set boundaries to support the client, right? So similar to how we are talking about this particular client, our intention becomes how do we get them to do the work, right? Like for example, I'll be very honest. I've seen a few things, and they sometimes shock me. Right. And so and this is sort of like sometimes I have to be very mindful of what I say from what I see, because for example, I've seen therapists who are in training get modeled that आप अपने अपने session में आप phone उठा सकते हो, right? I've seen that, right? I have seen that therapists sometimes have seen senior therapists um, take up calls because it's important, right? And so that's something that I've seen, right? And I've seen like um, sometimes what happens is that the therapist ka apna practical, logical ego reasons are also sometimes reasons why they think that they are prioritizing their own sense of self. Like there is a little bit of an ego chapter when it comes to um, how to use boundaries, right? Because boundaries are one of the best ways for self preservation, right? However, collectivistic culture के अंदर, not just collectivistic culture के अंदर, actual boundaries जो होती हैं वो interdependent होती हैं, यानी कि they are functional in nature. They are not walls or they are not no boundaries. It's not just कि आपकी सुनी जाएगी मेरी सुनी जाएगी, right? And boundaries particularly are seen everywhere, right? So for example, how are boundaries modeled in universities? Right? How are boundaries modeled by thesis supervisors, right? How are boundaries modeled by universities ho gaye, organizations ho gaya, right? Any and everything. Those other kind of spaces in particularly is how therapists who are early in their development, they kind of look around and they kind of see, okay, this is what is acceptable boundaries, right? Because there is a certain status quo that is established already in terms of what's allowed and what's not allowed and all of those things. And in order to support the client, it's very important that the therapist feels safe with interdependent boundaries. That means कि अगर therapist की चल रही है तो important है, नहीं चल रही है तब भी important है. What that means, for example, right? So अचानक से, right, I have this work commitment that I have this, let's just do a Pakistani thing, right? Like I have this dawat that I have to go to. Okay. And I know that the clients I work with are CPTSD clients, right? What that means is that in order for me to be congruent with the work that they do, and I don't want to sound black and white with this example, I'm just giving an example in this particular situation, that with CPTSD clients, I want to make sure that I'm present and available for them. So what that means is that my boundary would not be to just say no to them, right? And be like, meri dawat hai, mujhe jana hai, sahi hai. And by me being able to exercise the no is me exercising functional boundaries. No, that's not true. Sahi hai, that's me exercising walls, right? Because I'm not giving an option to anyone else, right? Actually, by me exercising containment, right, and being able to contain myself in terms of what my needs are, I am able to kind of recognize and really kind of say कि okay, मेरी दावत अचानक से आई है, let me curb my excitement, disappointment for a bit, let me get done with my session in a regulated manner so that I can be able to be present for my work also, right? That evaluation, right, कि कब दावत इंपॉर्टेंट है, कब क्लाइंट इंपॉर्टेंट है, कब आपको जो है वो सामने वाले शख्स को हाँ बोलना है, कब you have to say no to yourself, right? All of those capacities comes under functional boundaries, right? And that is very important to recognize when you need to help a client, because that is what you need to model for them. It's never just about um, 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 being able to kind of set a boundary only. Boundaries are not just one direction, and at the end we'll kind of go into this in a lot bit more detail. Boundary are two ways. Boundaries are me being able to protect myself and me being able to contain myself, right? So when I'm protecting myself, I can say no, or I can say yes. And for example, and is हाथ में protection में there is walls, नहीं 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 नहीं, no 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 no, or there is like no boundaries, जो आ जाए जो मुझे कर ले, जो मुझे बोल दे कुछ भी, all of those things, right? So protection, walls, or no boundaries. I also have a containment process, right? That means that I am responsible for my own actions as well, right? That means that agar mujhe kisi pe gussa aa raha hai, then I need to have a boundary of within myself to contain myself also. Ya mujhe agar dar lag raha hai, ab even this hand can have no boundaries or walls, right? So what that means is that if I'm just mustakil containing myself, and I'm not asking for any help or I'm not showing any vulnerability, then I'm not able to attune to anyone and have a sense of an intimate relationship with anyone. However, if I have no containment also, then I'm just spewing things, right? And I'm not able to kind of express my then I'm only just able to express myself and not able to take the responsibility of my own actions, right? So when it comes to helping a client, we've got to first understand that what is my relationship with protecting myself and what is my relationship with containing myself. And by this whole balance, right, I'm able to actually create a sense of functional boundaries. Because what I've traditionally seen is that some people, when they are learning how to set boundaries, what their mindset is that they're learning how to say protection walls, right? No, right? They are not learning how to say, कि यार, am I, my boundaries is also, can I be more open, right? Can I be more vulnerable? Can I be able to disclose things about myself that is actually beneficial for the work of the client? Can I be myself in the therapy room? Or am I going to wall behind the persona and the mask of what it's like to be a therapist and be completely like dorsal or transparent and all of those things? And that is something that we've got to learn first, right? And if we learn this first, then we are able to develop or help the client. Because what happens sometimes is that the client has an issue with any one of these four, right? And I'll go into more detail about this, about internal boundaries and external boundaries as well at the end. But this is the issue that really kind of comes up, right? Because, for example, if you have that client in particular, she has no boundaries when it comes to her protection. So anyone else can come in, i.e., her door, anyone can open the door and kind of come in. And she has walls when it comes to her containment. That means that she is not going to speak up to people, she's going to hold herself back, right? जिसके वजह से, एंड अगेन यहाँ पे वो भी आता है, एक सर्टेन लेवल ऑफ लाइक जवाजात भी आता है, बिकॉज हमारे पास ये लैंग्वेज नहीं होती. There's a certain level of rationalization as a defense mechanism that comes in, because we're not able to kind of language it in this manner that my not being able to contain or wall myself is okay, it's fine, it's acceptable, like that's the way things have always been, and thus it's supposed to be like this. I don't think I have an issue with these things because I can't do anything about it, right? And thus, by me going into a sense of acceptance or denial about the impact it has on the therapeutic work I do, it's supposed to be this way. It's supposed to be acceptable, right? And so that is something that is a challenge also, right? So that is something that if we really help first learn this for ourselves, two things will happen. A, there's going to be ruffles or shifts that are going to be seen in your own personal life first, right? Don't try anything out on a client if you haven't done it for yourself, right? So that's number one, right? And number two would be that we will empower, right? Because now we're moving slightly from a codependent or a anti-dependent place to a more interdependent place where we are collaborators, right? That we are able to kind of say, okay, what is the boundary in this particular space, right? How do we really set the boundary particularly? And it is sometimes really beneficial, right? If we have this image in our head, right, that boundaries दो किस्म की होती हैं, protection, containment, no boundaries walls यहाँ पे, no boundaries walls यहाँ पे, and I've got to figure out what is my functional kind of balance in any kind of situation. And if I'm choosing to kind of allow something in, it's once, it could be once, it could be all the time, it's my choice. If I'm choosing to contain myself, as long as it does not create a sense of discomfort, right? Like sometimes I will choose to share, sometimes I will choose not to share. I need to learn how to do both, right? If I, I'll be very honest, I and I don't want to. I want to be very mindful again. right? There is a reason why a lot of therapists don't take therapy, right? There is a reason, right? There is a reason why there is you'll be surprised on how many people who are in the field take therapy. And I'm not trying to say that therapy is the one way to kind of enhance awareness or internal mindset. No, but बहुत कम, right? And one of the main reasons for that is because there is sometimes a containment wall, right? And यहाँ पे थोड़ा सा here there's a certain level of culture that kind of kicks in also, because it's not just these things. Our boundaries are not just within what we've learned from our family, they're also something that we learn from our culture, right? So for example, sometimes with men they will have no boundaries when it comes to they will have walls when it comes to like protection, right? Or when it comes to like taking things and they have no boundaries when it comes to containment sometimes, right? So for example, they will go and take things without consent and all of those things. And sometimes, and I don't want to generalize, I'm just giving examples, I have to be very mindful of generalizing, right? But there are chances that gender specific cultural boundary settings bhi ho sakti hain, right? That no boundaries when it comes to containment. For sometimes for women there could be high boundaries or high containment because of culture, because of stereotype and all of those things. And in breaking intergenerational trauma, right, or breaking through cultural trauma is all about figuring this stuff out. And sometimes it starts with going to the opposite side. It's fine. However, in the end, it has to come into the middle, which is the more regulated kind of space where there is empowerment of choice. When can I? When can I not? Right? When will I say no? When will I say yes? Right? And that's the balance that we want to kind of go into. Okay. What this also does, right, that is that when you are able to teach yourself or your client about interdependency, right, that there is, I can accept your no, right? That if you say no, if I say no, right, and I'm saying sorry, right, I think this is the end of the session, right? I have taught the client or modeled the client containment, right, of my own rescuer, right? And I have to again do it from a place of emotional regulation so it doesn't sound dissociated. Like again, we're kind of building on top of those presets, particularly because I could say that thing and it can land badly because I'm dissociated and because it's like all of that stuff. You have to be very mindful of those things, right? So when it comes to that containment, I can say no. And what that does is कि my own savior complex, my own kind of rescuer complex, that's something that I'm containing, right? And because I now understand how to contain myself, I can very safely say no, because I also know that I really want to find value in and time and spend time actually figuring out what is the client's emotions really trying to say to me and figuring out. Okay. Another thing that can really help in supporting a client, helps the client's particular work, is also if you have your micro boundaries set up, right? Micro boundaries ka matlab, it's already pre-established together, right? That our session is going to be 55 minutes long, right? At the end of the session, we're going to be talking about sort of like the summary of what came up, right? If you prefer, we can do a regulation as well as at the end of the session. Okay, our sessions are going to be on a weekly basis, right? Our sessions are going to be particularly on a like, is that okay? Okay, do you want to go for bi-weekly sessions? Is that something that you're working on, right? All of those things are pre-acknowledged both ways, right? So that there is a certain level of agreement. We have a prepayment policy, we have a paid cancellation policy, right? This is the paid cancellation time frame that's there. Whatever your policies are, my intention is not to share, yeah, there should be a particular type of policy. Whatever your policies are, your contract is, that is your boundary. I do not accept social media invitations for my clients, right? So you're really telling them beforehand that these are things that you are setting as your way of creating protection for yourself, right? And is that something? And again, if that's something that conflicts with the client, you get to kind of communicate about it, right? You get to really kind of understand where is this coming from, right? For example, the client says, I need to know more about my therapist, right? And you can, and again, there will be, if I go into a wall at that time, right? If I go into a protection wall or a containment wall at that time, no, I'm not going to tell you anything about myself, right? No way, right? Then what it shows is walling. And what that does is it breaks the therapeutic alliance also. It can break the therapeutic alliance. Or you can be like, I'm going to disclose things about myself that you feel might be beneficial in the work, right? And that is called selective disclosure, right? And I'm going to do that in the session during this process. And I'm really going to hope that as you share, as I share things as well, you share things also. So rather than me freezing and walling, I created a functional boundary which was about a little bit of information, nothing to do with my personal information, more to do with what will benefit the client, as compared to, no, I'm not going to do that, no, right? And again, you are open to deciding what is the way that works for you best, right? Because my intention is just to share the different possibilities that are there. Your intention hopefully would be to be the best therapist you can be, right? And so you will decide amongst yourself what is the way that kind of works best for you in this process, right? So one other thing I want to kind of say here is financial boundaries, right? That there is a relationship with money that people have, right? And there is a relationship with therapy that people have also. That fi sabilillah, right? Therapy is therapy is a savior complex, right? And I understand this work, right, very well, right? That okay, that my intention is to help you. I have a sliding scale. I have no beef with sliding scales, right? Like, no beef. And this is just my personal thought process. I have no beef with sliding scales. But if you have a sliding scale, you want to be mindful of where it comes from, right? You want to really be mindful of, is it your no boundaries with financial boundaries, right? Is it that because you're having difficulty saying no to whatever the client is at, because there's a desire to help the client, right, at the cost of yourself, right? So you want to really, really be mindful for financial boundaries. Really be mindful for, because that's like amongst the contractual boundaries and therapist personal boundaries, there is such a challenge when it comes to like financial boundaries also. Not just when it comes to sliding scales, but even having conversations about paid cancellations, right? And I just want to say NLP, right? Like one of the things I learned from an NLP trainer of mine is that every conversation should be like bread, double roti, right? It should be as bland as bread, right? That means that it does not create any kind of emotional activation for you if you are having those kind of conversation, if you're having those kind of experiences, right? Um, are you sharing about your LinkedIn profile? It could be something that could be added on the contract. So when it comes to social media in general, right? So there are many ways in which many people kind of do things, and I think it's up to you to kind of really evaluate. In my personal opinion, you want to stay away from social media, right? You want to stay away from Instagram. You want to stay away from any kind of social media. LinkedIn is again a professional space. However, again, if everyone will find you no matter where you are, right? If you have a client that is going to find you, it will find you. Oh, there's one other thing here, right? Because just because we're on the topic of all the different kind of boundaries that's there, sometimes in order to save money for renting out a room, therapists invite clients to their homes. Be mindful of that, right? I'm not, I again cannot speak for everyone and everyone's situation, but that is like, you want to be really mindful of that stuff, right? Like obviously at home you can do your online sessions. However, in my opinion, you have to have a separate space, or you have a setup that's very polished in terms of entry and exit. And because it's not because there's a risk factor, there's an influence factor, right? You don't want to influence the client in a manner of something which is relatable to them, or something that is not related to them, which could just impact the transferential nature of the work. Or if you are doing it, You're very aware of it, that okay, this is the transference that you're inducing, this is what it happens when they're invited to my space, this is what happens to my professional boundaries in my home, right? That you're able to maintain that sort of like aura of, this is my house and this is the professional side of me and this is the personal side of me, and all of those aspects are very clear for you. So those are other things that you have to be really mindful for as you're kind of deciding what are the prior things that you're having in your practice. In my opinion, it's always better to have the place that keeps you the safest, right? Like, so for example, some therapists have this option of being available for the client when it comes to certain situations, right? Certain situations, certain intense situations, certain high risk clients. There is this option of like, okay, you have my phone number, you can call me at any time. Certain therapists, and I've seen therapists, they get calls at like late night because there is always a moment of dysregulation that the client can, especially if you're working with someone, that the client can go through. My approach, trauma informed, has always been that the client always has the capacity to just go through that peak, and then we can kind of work with it. So what we do sometimes at the center is that we have emails that they can kind of share, right? So we have emails for them so that there is a certain kind of time frame boundary as well, because as therapists you need self-care also. If you're always on, or if you're always available for your clients, that will create a sense of difficulty for you to separate your professional life and your personal life, because this work does carry with you, right? And all of these things are so important when it comes to creating a professional setup, right? Because as you're creating a professional setup, again, very mindful for walls and no containment. So when I'm saying a professional setup, I am not implying walls or no containment. I am implying interdependent professional setup, right? That you feel comfortable with and you feel safe with. It is very important. And if you have that set up for yourself, that will help you be more emotionally regulated. And because it will help you be more emotionally regulated, you will be able to set better boundaries with your clients. And because of that, you will be able to actually do the work more effectively. Okay. So really do think about all of these things, right? It is very important for you guys to really ask yourselves as professionals, what is your boundaries here, right? Am I going to see them at home? Am I only going to see them online? Is my personal life that dysregulated right now because of what I'm going through, that I have to put an end to my end or pause my sessions or my client work, right? That is again an evaluation, right? Because you have to contain your own need to help people, because you have to first help yourself sometimes, right? For example, if I go through something or someone else goes through something that is dysregulating, right? So, for example, they go through a life experience, and life has many ups and downs, and everyone will have a life experience. There will come a time when you will have to be like, I need to pause my sessions, right? And that's a containment boundary that you're setting for yourself, right? And it has to be evaluated with the supervisor, because it could, because it's stuff is tricky, right? Because it could even be like, I'm calling it a containment boundary, but in actuality, I don't want to, like, deal with some of these clients, and thus I'm walling myself because it's creating a lot of counter transference that I'm not ready to deal with, right? And so what helps you evaluate this stuff, at least at an earlier age, is supervision, right? Is supervision, that this is where you really, and I'm not talking peer supervision here, right? I'm talking from a place who might be a trained supervisor that you're paid for, so that you have an hours long time, and they're professionally set with those boundaries as well, right? And that will really help you evaluate what is really taking place for you in this work, right? And this is the way you really stop ethics blurring, right? If you have set up all of these micro boundaries, you've done the emotional regulation work, you have set up a supervisional system as well, whatever it takes, then any kind of fluctuation in that system means that there's something happening, right? So for example, let me give you an example, right? So for example, I have this setup that email 10 to 6 through the center, having this kind of, the space is available for that. Okay, now what happens is that achanak say there's a client that comes in, and I'm noticing myself wanting to kind of give the client my personal number, right? Or being like, okay, you can call me anytime, right? Or having that, or even my work number, right? And you can call me at any time, right? All of those kind of things. That is an alarm, right? That's a bell that's ringing, right? That means that there is something happening for me, because I am now not following my own boundaries that I put so much work and asked other people and set up for myself. And because that is happening, that is information for me that there is transference and counter transference taking place there. And that really helps me protect the work, right? Because that is now helping me set up safety measures for myself and for my client also, in terms of the way I can kind of communicate and what's the work. And so now knowing that kind of shift from my side, I can kind of contain and be like, okay, what is reminding me? Okay, my rescuer is coming in again. Okay, how come the rescuer is coming in again? It's coming in because they're reminding me of those experiences that I had in my past, and that's why I need to help them again. I'm like, that's not this situation. There's a difference between the past and the present. And so I need to set my boundaries first with myself, contain myself, ask for help, go to my therapy, go to my supervision, really create the resources I need, so that when I'm working with the person, I'm able to actually create functional boundaries for myself as well, and thus model it for the client. And that's what really helps the client as well, right? And it's very important that we see boundaries for what they really are. Usually what happens is that people just see boundaries as this kind of overt thing, that is all about like just creating walls and protections. And it's not just that. It is a huge piece of information, right, about what is your system structure that you're working with. And if there is any up and down in that kind of thing, it's your first safety radar also. Okay, there's something happening, because these transferences and counter transferences are always taking place in the work, right? And so it really helps you kind of set this up. And I really hope that you guys really get an idea on how to, when you're starting your own individual practice, how to really take this forward as a system that can protect you and protect your clients also, right? And I think that's sort of like what's very important when it comes to these things. Okay, so that was number two, right? So number one, emotional regulation, and how to handling emotions, right? That will happen when you really see emotions as a way of holding space rather than the narration, and being able to create that separation. Once you have that information in your mind, it feels a lot more authentic in terms of why you're doing it, because it's coming from a place of understanding that emotions are information, right? That's number one. Number two, boundaries that will help you and your client, right? And we talked about that in terms of protection, containment, and how that really helps you create safety for yourself in terms of your own transference, counter transferences, containment, and all of those things. And it's not just about walls, it's about being able to create a sense of functional experience, particularly. And that includes financial boundaries also, because you could have all the boundaries, but you could have like clients that are creating delays in payments and all of those things. And again, that is also helping you understand their relationship with money, right? Because it's not just about their relationship with whatever they're having an issue with. It's also about understanding what are their boundaries regarding money, right? And what is the therapist's boundary regarding money, right? Is this a charity? Is this something, a profession? You need to pay your bills in order for you to be a professional therapist, right? And it's not just your bills. You have to do ethical work with it. You can't just be like, I want my clients to come back continuously so that my bills continue to get paid. That is not ethical at all, right? You have to really evaluate what is the reason why you're doing this work, right? And we've talked about that in the day one process particularly, right? And so when it comes to your own relationship with money, you have to have your boundaries set up for that. When it comes to the client's relationship with money, it can help you provide information. Okay, clients have a difficult relationship with money, or what that is, and how can I support the client functionally with it, right? And have an additional person that you really take these kind of processes through, particularly also, so that you can kind of benefit from like a third person's perspective as well. And a supervisor is usually the person that you go to these things for, especially at an early stage of the development, career wise, right? Okay. Lastly, when it comes to strategies, right? Let me kind of just give you a little bit more about the protection and containment wala. Okay. So what happens is that there are three kind of boundaries, right? So there are physical, right? There are emotional, there are physical and sexual and also internal. Those are the three kind of boundaries in the Pia Mellody model particularly. Okay. So when it comes to physical, okay, protection and containment, right? So when it comes to physical, we have no boundaries walls. That means that no one can, and so physical se kya murad hai? Physical se murad hai touch, right? So for example, touching things, right? It could be your things as well, other people's things ho sakta hai, body ho sakta hai, it could be anything to do with touch. And again, sensitivity here, right? In our culture also, there is already a lot of stigma and taboo when it comes to sexual boundaries or when it comes to physical boundaries, right? However, it's very important to understand this from this therapeutic lens, right? Because without us having these conversations, what happens is that we keep these things as taboo, right? Okay, we can't talk about physical boundaries, we can't talk about sexual boundaries, and thus we don't talk about even internal boundaries, which kind of creates an impact for us. All right. So when it comes to physical boundaries, it is all about like touch, right? So okay, my containment, right? So for example, physical boundaries is, can other people touch me, or no, never, or I don't have any say in it at all, and other people can touch me all the time, right? Like all of that stuff, right? So, and what happens is that abuse really does create a dysregulation when it comes to these boundaries, right? When it comes to physical boundaries, if someone has been physically abused, if someone has had sexual abuse, all of these things kind of create a impact, right? And so when we're able to develop interdependent boundaries, so what that means is that I have a choice, that I can say when someone can, no, cannot touch me, and when I can say yes, they can touch me. That's the hand on both sides is important to have, right? That I have to. So, for example, I used to have a experience of. I'll be very honest, right? Like I had a huge experience with bullying growing up, right? Like it was a huge experience with bullying. So what happened was that because of my experiences with bullying, which is what that people would like physically break through their protection and come in and be able to kind of hit, obviously, right? And that's the kind of experiences that you would have. So what would happen was that when it comes to bullies, I would not be able to defend myself, I would not be able to protect myself, right? And so I never learned how to say physically कि आप मुझसे दूर रहो, right? Stay away, right? Because anyone who would be bigger, I would kind of go into that kind of freeze mode, right? And though without me learning how to protect myself, I could not develop a sense of safety within myself. And so that was very important, right? So that was one aspect of the work that was there. So being able to kind of protect yourself, say no, right? And have that kind of space, that was one, right? Another one is containment. Can I do the same, right? Can I stop myself from like touching other people without their consent, right? And that's the capacity. Or do I never ask for a touch, a sense of touch, right? Because human beings, what happens is that we have oxytocin. Touch is again, and again, I'm talking about with safe people, I'm talking about it with a place which is in containment, right? So there is a certain level of appropriateness that is required for this particular sense of touch, right? So your sense of touch, right? Is it appropriate? Is it safe, right? So we have to learn when it comes to these things for, I'm just trying to figure out the hands, when it comes to these things for both, right? Can I, like, for example, because of that abuse and bullying, right? Any touch for me became scary, right? So when it came to like me physically giving, like, for example, asking my mom for like a hug, right? Or asking like anyone to like kind of be like hug, like no, anxiety like crazy, cannot, right? And that comes from my past experiences. So what I had to do, just trying to figure this out, right? So what I had to do was I had to learn protection, say no, no, and I had to learn functional boundaries when it comes to like containment, right? So my walls which were up, I had to kind of bring them down also, right? So that's how I set functional boundaries when it comes to physical touch. This is the work that you've got to do for yourself first, right? And then help the client understand this also, so that they can protect themselves, because once they are able to protect themselves by being open and saying no at the same time, that's when it becomes functional for them or for you or for anyone else also, right? That's how you kind of start healing the work. Same thing with sexual health also, right? It could either be no, right? Or it could be I have no boundary with it, or it could be like a sense of full containment, like no, or it could be like no boundaries with it. And it's very important that even with sexual health, similar to physical health, that we have the capacity to contain ourselves and say no or yes to another person, and say no or yes to ourselves. It is both ways. It's super important, because for a lot of times what I do see is that most of the conversations are binary in nature, right? Where it's displaced accountability, right? That, for example, it's all about the other person or it's all about me. No, it's about both, right? Like I've got to learn skills that can help me say no to people. That's why I went to like I started going to the gym. I started physically becoming stronger for myself, right? Because it's not like I'm gonna get bullied again, but it's like I have the internal child in me that knows the adult me has this skill now, right? And because the internal child in me knows that the adult me has this skill now, if I say need to say no to a person, my body trusts that I can, right? And that is something that I had to learn and develop, which helped me set my boundaries. Similarly, right, when it came to asking for physical compassion and touch, right? So, for example, I had friends, right, and in the friends group, like it would be so difficult for me to kind of, even I'm talking family as well. Like when you have like a funeral or something around those lines, and you want to be able to support your family and be like, it would hurt, like literally. And so being able to build that skill to be open to kind of be like, I can ask for physical holding and safety, like hand holding even with my family, so that they can kind of share, right? Vulnerability, absolutely, right? So that they can share, so I can be supported. That's a strength that I had to learn, so that I could work on my boundaries, because once I had those two things developed, then I was able to kind of work on those things, right? And help others kind of figure out what are some of the challenges that kind of work on it. Number one. Second is sexual. Same process on a sexual manner as well. It's very important that we develop no. I have a right, the functional right to say no and yes when I want, and contain myself also when I say no to myself and yes to myself also. That I have a right to express and not express as well, and I have to choose when I have to say no as well. So it's both sides, and it's very important. Okay. Third one, internal boundaries. That's the most fun one, make I'd say, because it's the one that kind of really kind of becomes relatable to people as well, right? Because it has to do with internal boundaries, right? So how does internal boundaries work? Okay, when it comes to when it comes to protection, right? A lot of people think that the protection is confusing, right? Protection happens from the mouth, right? Okay, I am saying no, right? Technically, that's not true, right? Protection technically happens from the ear. What am I filtering out first is the question, right? That's what protection is, right? So for example, someone, because sound has waves, it's not a physical thing. I can't push a person back and stuff like that, right? So it's not a physical thing. Sound is going to travel, right? And so when the sound travels, imagine if someone says, yeah, can you do this for me, for example, and I am already like booked to the brim, right? Like I'm already booked. So what happens is I go in, it goes into my ear. My ear is where I start protecting myself from. True, untrue, need more information. Can I? No, cannot, right? And so with my ear, I'm able to filter myself. So what happens when I have walls? When I have walls, what happens is I'm protecting myself by not listening. I don't listen to anyone, right? Like because I'm walled in. आप जो भी बोलो मुझे कोई फर्क नहीं पड़ता, right? That is the ear. या आप जो बोल लो, critique, tankid, all of those things, it's going directly in my ear and I'm believing it fully, right? That means that I don't have the ear filter, right? And one of the best ways to create an ear filter is very simply, true, untrue, need more information. That evaluate, right? True, untrue, need more information. So, for example, when it comes to physical protection, goes to the ear. Your ear goes like, okay, I wanna be able to create a functional boundary. I wanna say yes. Okay, can you do this for me? True, untrue. Do I have the space? Yes, I have. So, yeah, okay, right. So that the ear is the first way to protect, not the mouth. A lot of people assume that we use our mouth to protect ourselves. We don't. We use our mouth to contain ourselves and ask for help. It's our ear that is used for protection. Pia Mellody, right? So if anyone disagrees with me, that's fine. It's fine. It's absolutely fine. I'm just sharing what she said in the book. Okay. Containment, right? So when it comes to the containment aspect of it, right? If I am feeling angered, right? And if I feel like if I feel triggered, I don't want to use that word. If I feel activated, or if I feel like I have not had enough space, whatever, right? If I feel like, let's do the word trigger, right? Let's imagine we're kind of using the word overwhelmed. Yes, let's do big emotions, right? Let's do overwhelmed. If I feel overwhelmed, okay, and I imagine if I'm able to regulate a little bit of it, right? I'm able to regulate a little bit of it. I see something, it's bugging me out, right? Then what I've got to do is I've got to say, I've got to be able to contain what I say, right? By containing my mouth, right? I can choose the words and be mindful of whether I need to say something or I don't need to say something, right? And that's how I'm choosing to contain myself, by deciding whether that is something that I feel I want to ask for help or I don't want to ask. So, for example, when it comes to big overwhelming emotions and I feel like I need to say something, obviously first thing I'm going to do is I'm going to emotionally regulate myself so that what I say has effectiveness, right? I don't want to just say it because it'll help me feel good, and that's no boundaries, right? Because if anything, anytime I get triggered and if I'm not able to contain myself and I have no boundaries, then whatever I'm saying, I'm spewing. You might notice that sometimes with a lot of people who have anger, right? So anger is a very common thing where people don't and there are other reasons for that. I'm just kind of simplifying it very much, that anger sometimes has no boundaries and it kind of comes out, and you sometimes see that as an issue for a lot of people, right? And so when you want to help them, you want to really, you can't just ask them to set a boundary and contain yourself, because that is not meeting them where they're at, right? The first thing you want to ask them, and this is a tangent, but just because we're kind of giving this resource away, right? They're going to, first thing you want to ask them when you're working with anger is, does it have a benefit, right? Does it have a benefit? Is emotional holding, is it trying to tell you something? Is it the best way for you to set boundaries, right? Does the anger really help you say what you need to say, right? Because anger itself is not the bad thing. So once that relationship with anger is developed from an emotional intelligence kind of space, and you're able to create that different relationship with it, then emotional regulation tools, and you can kind of really kind of, then it's more possible to actually contain those emotions also. If you just go into a sense of containment from the start, then all you might be doing is suppressing, right? And our intention is never to suppress emotions, because if you start suppressing emotions, what happens is they'll blow, right? They will absolutely blow up, right? And so it really doesn't create any value. So you have to understand that sometimes if you're creating a boundary with someone and it's not really clicking and it's not really happening, it's probably because there are certain steps that need to happen before this in order to actually make it more effective for you, right? And so that's something that you would want to kind of work with as well. So when it comes to these experiences, it's important to recognize that when it comes to internal boundaries, it is also about, like for example, do I choose to take on criticism? Protection, right? Do I choose to kind of flood on someone else? Containment, right? Do I kind of choose to? I just want to give examples here, right? Do I choose to kind of no walls would be like not listen to other people, apni chalana, right? Like for example, be stubborn. That's protection walls, right? Do I choose to be vulnerable and ask for help, right? That's containment, right? Do I choose to trust my own resiliency and do it on my own because I believe that I can? Containment, right? And it's not like it's a permanent thing. Whatever you're choosing right now does not have to be a permanent thing. It can exclusively be from situation to situation and depending on how you're kind of going through that process. And I'm really like my real hope is that when it comes to like how do you do this with your client work is that you develop this kind of language with your client, right? So imagine, I'm assuming, right? So imagine that all of this content that we've covered today, right? We've kind of learned it, like we've integrated it, we've really learned it, number one, right? And now imagine you've done that work for yourself and you've tried it out. You've like we have a page. So what you do is you write this on a page and you write down like a grid pattern. I'll just show it to you. You write it down like a grid pattern, right? Like protection. So when it comes to physical, sexual, right? Physical, sexual, and aapka internal, right? And then you write down next to it, right? Like in terms of, I'll just show it to you. Then you write down next to it in terms of whether it's whether there's no boundaries, whether it's walls, or whether it's functional, right? And so you'll have this kind of thing. And so I'll just show it to you. Protection, containment, protection, containment. Okay. Yeah, I know it's really horrible the thing I'm going to draw right now. I just hope it's visible. Okay, so imagine like this, right? Oh my God, I have to see this, right? So physical, sexual, internal, right? And you draw this with your clients also, right? And you write down and you make this kind of graph, right? So physical ke andar protection containment, right? Sexual ke andar protection containment, सही है, और internal के अंदर protection containment. And यहाँ पे आपका आ जाता है नो बाउंड्रीज, राइट? यहाँ पे आ जाता है नो बाउंड्रीज का कॉलम, यहाँ पे आ जाता है आपका walls का कॉलम, यहाँ पे आ जाता है आपका functional का कॉलम. So for example, what you do is you ask the client or ask yourself even, okay, imagine a time, right? Okay, so when it comes to physical, right, what do you find yourself in? When it comes to, for example, protection, right? Do you find yourself in no boundaries or walls? Right? So you go for each one of them. And you can always be in both, right? And obviously what we're looking for particularly are tilts, right? So you're looking for tilts, right? So it's not completely about कि आपका एक होगा या आपका कभी जिंदगी, there could be a time when it could be one, there could be a time could be another one. And what will also happen for a lot of people is that what you will imagine, they will kind of move towards functional. I have functional boundaries. Like what I have is like functional boundaries, right? And that's a very kind of common thing, right? I understand that I'm just going to remove the blur in the background, yeah? So what will happen is that for a lot of people, you will have this desire and genuineness of functional boundaries, and that's true because a lot of people are functional in nature, right? They do have, most of the people will have functionality, right? We can't get through life and be in a social setting if you don't have like any kind of actual functionalities to kind of take place. However, what we're trying to go into is where is the tilt, right? Where do you struggle? Where is the tilt that kind of takes place? Oh, so for example, when it comes to physical protection, I find myself in walls. Okay, so what do you invite them to do? Write down a memory. associated to that. Okay. Okay. When it comes to physical containment, am I in no boundaries or walls, right? So when it comes to containment, am I containment? That means this wall particularly. Do I find myself in no boundaries or walls? I find myself in walls, right? So what that means is I find it difficult to ask for help, right? So यहाँ पे आपने memory डाल दी. Do you remember a time when you were in walls, right? You do all of that. When it comes to sexual, physical, no boundaries, walls, so you figure out which one is for each, right? And so you what you will notice is that you will form a pattern here, that you will notice some people will have a lot of walls and some no boundaries and some, all of that kind of takes place. Okay. And then what you do is that you invite them to reimagine what that memory would be like if it was in functional, right? And so what you're doing is you're really helping them remember or relive or narrate or re-change what that memory would be like if that was in functional. And then you write down all the functional ones as well, right? And this is a tool that I highly recommend that you guys do, particularly for yourself also, and then you particularly do for with your clients as well. uh, those people who are going to be the people who are at Zoom and those people who have registered for the recordings, what we'll be doing is we'll be sharing you resources particularly for this. So there is a particular, this is the hand-drawn version of it. There's an actual paper document that we have that has the descriptions of these tables made. So it really kind of gives you an example of what's a protection, what's a wall, what's a no boundary, and all of those things for physical, sexual, and internal. So it has that kind of description on one side. And on the back side, it has the empty kind of graph as well. So what you will do is you will get all of these things with you on the drive, and you will get another paper that has all of the protection, containment stuff associated with it, so that you can use it with your client work, right? So that you can use it with your client work, and that's something that will kind of help you first do it for yourself, right? And notice the resistances and the challenges, and if the mind is moving to functional all the time coming up, and then you move it to like the client work as well, right? And it's an active tool that you can use. We use it a lot, particularly at the early stages of therapeutic work, where you're really helping the client develop boundaries. Whenever you have a client that has gone through abuse of any sorts, it's not common, I wouldn't use the word, it is understandable for there to be boundary breaking for them, right? And so helping them, empower them by helping them use this particular language, it really helps them become more equipped, right, to see themselves as not just wounded but having to learn the capacity to protect and contain themselves as well, right? And this, I do believe that this model of boundaries really helps you understand these things in a very kind of effective kind of manner, right? So those are some of the things that I feel is a particularly useful strategy that I think I've used. This was something that came my way like 10 years ago, right, when I was working in like rehabs, and I went to the UK and got trained by what do you call Hilary Betts, and she was an amazing person, and that's where my journey of trauma work really kind of began, because she was trained by Pia Mellody herself, and she had done the survivors training that Pia Mellody does, and so all the resources that came from that became available, right? And again, she really shared this information, and I do think the value of these particular trainings is so that we can share this information as well. um, I, I really hope that particularly on this day there was a lot of content, right? And that's the intention. I really want to give a lot of this content that is available here at the space, right? And the intention behind this is so that these tools become more widely accessible, they become more open for people, so that their style of therapeutic work becomes even more better. So that's one of the main reasons why these drives, these recordings are being given. I really do. I do want to tell people about the option of the recording and the certification as well. So those people who wanna, so what we're doing is, for these trainings are free on YouTube. Like we're going to be coming right now. If you want to have these recordings for later use, You can opt for a 15,000 rupees purchase for all the recordings that you're going to get. Number one, you're going to get a drive link and being able to access the Zoom as well in order to engage and ask questions particularly. That's number two, right? If you want a certification for this as well, what will happen is that you can even what's the intention for the certification? Usage, right? Like, I really want people to be able to use this therapist training program as well. तो अगर आपको सिर्फ recording चाहिए, that's fine. आपको recording मिल जाएगी, आपको drive मिल जाएगा, so you can actually use the resources in it in your therapeutic practice. अगर आपको, if you need certification for this, what will happen is that you need to just share a audio recording for 20 minutes for feedback. Okay, because I do sometimes, from my experience, what I've seen is that sometimes there is a fear of the vulnerability, right? Sometimes there is a fear of actually recording and getting feedback because of the protection and containment boundaries thing, right? And so the intention is there is no pass or fail in the recording, in the audio recording is a 20-minute mock session of you and your client, and it's not a real client, it could be anyone. You're just having a 20-minute mock session that you can give an audio recording for the certification process, so that you can get feedback for the training, right? And you can get feedback for the application as well, that okay, this is something that we are using, this is something that we're not using. And again, the intention is that if you get the feedback, hopefully you can implement some of the things, you can implement some of the resources. It can hopefully create a little bit more of an accurate journey for you in terms of how you can start doing this process. Because one of the main things that I've learned in this whole story is that you got to do a lot of work on your own by yourself, right? And I really wished that there were resources or people available that could kind of at least guide me in some direction, right? Because there was a lot of money that I spent on getting like information, and I'm sure it helped in compounding everything. However, I do wish it was something, sometimes it was a little bit more easier, sometimes it was a little bit more cheaper, and all of those elements. And so I really do understand that factor, and I'm really hoping that by making these trainings like accessible now, having them clearly recorded, having them clearly kind of showing the details of each of these kind of topics. And we have 11 topics to cover. We're down with 2, so we have 9 more to go. Some of them are going to be really fun. We get to add really like a lot of value in sort of like an open forum, and this is just one resource. I'm really hoping that you're not banking on just this resource, right? And you got books and you got like other things, and I'll even add like a book drive on the Google Drive as well, so that people can really start actively reading books and finding that stuff, because this is what it takes, right? And if you want to manage your burnout, all of that stuff, this is what it really kind of had takes in, right? So that's one. Another thing I wanted to kind of add, and I'm really so I'm hoping you guys will get the drive link via email in just a week, in a week or two. I'm just really hoping that some of the resources get added up so that we can kind of add them to the drive link and kind of share them stuff, and hopefully we'll continue to kind of actively upgrade this. The second thing I wanted to talk about particularly also is some of the upcoming trainings that are coming up in the Trauma Release and Wellness Center. So I have 2 trainings that are coming up after this one. It's in April. It's going to be about becoming a trauma-informed practitioner. This one is particularly in relationship. So we had a whole 4 years of working with Arizona particularly. And now what we're trying to do is we're trying to really develop and expand the training particularly from ourselves as well. So we are certifying people as trauma-informed practitioners, and it's a 4-month-long training. It's going to happen on a weekly basis for 4 months. It's going to be allowing you to integrate the how to become a trauma-informed practitioner in your practice. So if you are a therapist, if you're a coach, and you really want to feel, if you really feel that that's something that you really will find benefit in, so it's a 4-month practice. It will have a lot of um, uh, additional topics. So none of these videos, that's not the content. The content is going to be exclusively about how to become trauma informed. Number one, how to use it in therapeutic work, how to use it to clear up transferences and counter transferences, what are some of the resources that are available. It goes into a lot of depth, but it also goes into a lot of depth in terms of practicality. There'll be groups, there'll be skills practices. It's really all for professionals who are really wanting to and really believe that trauma informed is a way that they feel that they would like to kind of practice, at least learn about and practice particularly. So that's one, and I'm hoping that we can launch on our Instagram particular page in terms of the details, the pricing, and all of those things. Hopefully by today or tomorrow we will be launching that. So that's one aspect of it. The other training that I want to talk about particularly is one of my favorites is TRE. So tension and trauma release exercise. This is in an internationally affiliated training with Sai. Sai Khanani is our affiliate TRE trainer that we're working with. I'm becoming a TRE trainer as well. I've been doing TRE for the last 4 years now. This is going to be our fifth batch that we will be doing. So I'm really excited about that as well. And TRE is basically tension and trauma release exercise. It's a somatic modality that is used globally. It was developed by Dr. David Berselli. And so I'm really hoping that TRE is, TRE, reason why I feel like it's one of my favorite trainings is because the body does not lie. Simple, right? Because no matter what you say, right, everything is visible in the body. And so what TRE does is that it helps you develop those skills of somatic therapists, right? So it helps you become a somatic practitioner, helps you understand how to use the body's natural tremor mechanism to release stress and trauma that is stored in the body, right? So for example, you have all the life experiences that you've gone through, the number of times you've talked about muscle memory in particularly. So all of that is in the fascia, it's in the body, right? And so no matter if I have awareness about it, there's sometimes that experience is stored in my body. And so what TRE does is that really helps you through tremors, helps you release the tension that's stored in the body. And it's a non-verbal way of doing the work. It's really good with pre-verbal trauma, sometimes with intergenerational trauma as well. It's something that's really good as well. So all of these are happening. Most of these trainings, all of these trainings are going to be happening online. There are going to be some components of the trainings that are going to happen in person, such as meeting on Zoom and having groups and all of those elements, because both of them are quite in-depth. That even the trauma-informed practitioner training is quite in-depth, and so is the TRE training. It's quite in-depth. And the intention behind this is to really kind of make these things more accessible and make these things more effective for people. So that was basically everything from today. I hope that the content today was effective. I hope this really helps you in your journey to become more effective therapists as well. Life coaches, practitioners, just even if it's not as a practitioner, even if you're a client yourself, or even if this is for your own personal benefit, I really hope this information helps you in some way or the other. Thank you for spending your Fridays with me. And I'm looking forward to seeing you guys next week as well. Right? So take care, guys. Hopefully this was beneficial.